Ever find yourself nodding along when a medical term gets thrown around, like you totally get it, but then bam, it's on your chart? Or worse, your kids, and suddenly you're like, wait, hold up, I need the actual deep dive on this.
Exactly. Knowledge is power. Right.
Totally. So that's what we're doing today, diving deep into acute myocarditis.
We've got studies galore, including this seriously thorough review from JAMA, to help equip you to ask your doctor the right questions so you feel confident about your heart health or the heart health of your loved ones.
Okay, so first things first, what are we even talking about when we say acute myocarditis? Because I'll be honest, it sounds a little intimidating.
Let's break it down. We're talking about inflammation, which is your body's natural defense system. But in this case, it's happening in the heart muscle itself, the myocardium. And this isn't like a heart attack where you have blocked arteries. Myocarditis is all about this immune response.
So it's like my body is trying to be helpful, but it's accidentally picked a fight in the heart department. And this JAMA review mentioned some numbers that made me stop and think, we aren't just talking about a few isolated cases, are we?
Right. This is something to take seriously.
Right.
We're talking about 4 to 14 out of every 100,000 people worldwide every single year. Now, that might sound small, but that translates to a lot of people dealing with this.
Wow, that's a lot more than I would have thought.
And while most cases are mild, the reality is mortality is still a factor, ranging from 1% to 7% overall. Plus, it can impact anyone at any age, though it often looks different in adults versus kids.
Which is exactly why we are here today. We want to equip our listeners with information so they can make the best choices for themselves and their families. So what causes this heart hiccup in the first place? I've read that viruses are often involved.
You're on the right track. Viruses, like the flu or even coronaviruses, are common culprits.
Okay, so we should probably get into the specifics on that later on then.
Absolutely, we'll unpack that a bit more. But there are other potential triggers too, like autoimmune disorders such as lupus, certain medications, and even in very rare cases, vaccines.
See, this is what I mean about needing that deep dive. It's not always a simple answer. And the review even mentioned that the causes of myocarditis can be different depending on where you live. Like Chagas disease, which I'll admit I'd never even heard of before, is a much bigger factor in parts of South and Central America.
Exactly, it's about connecting the dots. And that complexity extends to how myocarditis shows up too. The symptoms aren't always crystal clear, unfortunately.
Yeah, from what I've read, the symptoms can be super general, which makes it really hard to self-diagnose, right? Like chest pain seems to be pretty common, but that could be a symptom of so many different things.
Right, but you also see people with shortness of breath, fatigue, some folks even faint. This is why catching it early is so crucial. If you're experiencing these things, especially together, don't ignore them. Talk to your doctor.
Absolutely. Speaking of doctors, how do they even diagnose something like this? It seems like it could be mistaken for a lot of other things.
You're right, it's not always obvious. They'll start with your medical history, do a physical exam, and then they'll likely order some blood tests. These blood tests can spot those telltale signs of inflammation and show if your heart muscle is stressed.
I've heard of EKGs being used for heart stuff, and I'm guessing imaging is important too.
You got it. An electrocardiogram, or EKG, can reveal if your heart's rhythm is off, and an echocardiogram, which is basically a fancy ultrasound for your heart, shows how well your heart is pumping.
So they're looking for abnormalities in how the heart is actually functioning.
Exactly. But the gold standard, the most definitive way to diagnose myocarditis, is often a cardiac MRI or even a biopsy of the heart muscle itself.
Okay, so there's no single test. It's more like putting the pieces of a puzzle together. And once you have a diagnosis, is treatment the same for everyone?
Here's the thing. Treatment really depends on what caused the myocarditis and how severe it is. Sometimes it's about managing symptoms, like using NSAIDs for pain.
But for more serious cases, I read that the review talked about heart failure medications and even temporary devices to help the heart pump while it recovers. There was also some mention of steroids, but it sounded like that was a bit of a debate in the medical community.
You're right, the use of corticosteroids is controversial. Some studies show benefits for certain types of myocarditis, but more research is needed. It's definitely something to discuss with your doctor to see if it's the right approach for you.
It sounds like communication is key with this condition. Don't be afraid to advocate for yourself.
Exactly. The more you know, the better equipped you are to have those productive conversations with your healthcare providers.
So let's say you've been diagnosed and treated. What's the long-term outlook? What can you expect down the road?
The good news is many people with acute myocarditis recover fully. especially if it's caught early and treated appropriately.
That's reassuring.
But, and this is important, there can be long-term complications.
Yeah, the JAMA article mentioned things like myocarditis recurrence, where it comes back again, and even a risk of sudden cardiac death in some cases. It also mentioned something about high sensitivity troponin levels and elevated C-reactive protein levels, which, honestly, I have no idea what that means.
Those are markers of heart muscle damage and inflammation. And while they sound scary, they're actually incredibly useful for doctors. They help paint a picture of what's going on and how well the treatment is working.
So more information is always better when it comes to diagnosis and treatment.
Exactly. And they're also why follow-up care is so crucial. Your doctor will want to monitor your heart health long-term, likely with regular checkups and possibly more imaging.
So vigilance is key, but there is also reason for optimism. Many people bounce back completely.
Absolutely, especially with early detection and proper management. It's all about being proactive and informed.
We've covered a lot of ground here. It's amazing how much goes into understanding a single condition like acute myocarditis.
And even with all this research, there are still unanswered questions.
Which brings up something that I found really interesting in the research. The review mentioned that sometimes the cause of myocarditis, it just remains a mystery. And I would imagine that's got to be frustrating for everyone involved, when you don't actually know what caused it.
Absolutely it is, yeah. It's like trying to solve a puzzle, but you're missing some pieces.
Yeah.
But even with those mysteries, the JAMA review we've been discussing, it actually highlighted some less common myocarditis triggers, like, get this, drug-induced myocarditis.
Yeah, I remember reading about that. So certain medications can actually cause inflammation in the heart.
Exactly. One example the review specifically mentioned is clozapine, a medication used to treat schizophrenia. And it turns out about 3% of patients with treatment-resistant schizophrenia who were taking clozapine developed myocarditis.
Wow, 3%. That's actually a lot higher than I would have guessed. It makes you really think about the medications you take and what the potential side effects are.
Absolutely.
Which makes me think about another potential trigger we hear about a lot these days, vaccines. There's been so much talk about that.
It's important we address this head on. As you said, there's a lot of information and misinformation floating around. So the JAMA review specifically looked at myocarditis following the mRNA COVID-19 vaccine and found that the estimated incidence was about 2.1 cases per 100,000 people.
Okay.
And it's crucial to remember that the risk of developing myocarditis after contracting COVID-19 itself is significantly higher than any risk potentially associated with the vaccine.
Right. It's all about weighing those risks and benefits with accurate information and trying to keep a clear head, I think. And I think that's a good rule of thumb in general, right? Like, get your facts from reliable sources and not just, what you see swirling around social media.
Absolutely.
Speaking of specifics, the review also went into detail about giant cell myocarditis. And honestly, that sounds kind of terrifying.
I get it. I mean, the name alone is enough to make you nervous. Giant cell myocarditis is rare, thankfully, but it is very serious. It gets its name from the presence of these large cells, giant cells, in the heart muscle. And unfortunately, these cells can cause significant damage, potentially leading to heart failure.
And if someone has giant cell myocarditis, the treatment's different too, right? It's not just about managing symptoms at that point.
Exactly. Giant cell myocarditis often requires what's called immunosuppressive therapy, which means using medications to suppress the immune system's attack on the heart. This can include corticosteroids, which we talked about earlier, as well as other drugs like antithymocyte globulin and cyclosporine.
So early diagnosis and really aggressive treatment are key in those cases.
Absolutely. The sooner it's caught, the better the chances of a positive outcome. And that brings us back to why understanding the symptoms and getting medical attention if anything feels off is so important.
Right, because even though myocarditis can be serious, many people do recover fully, especially with the right treatment and early intervention.
That's such an important point to emphasize. Myocarditis isn't a death sentence. There's hope, and there are things you can do to protect yourself.
That's really reassuring to hear. And speaking of different forms of myocarditis, I noticed the review also mentioned cardiac sarcoidosis, which can apparently mimic myocarditis. It said that this condition often involves something called high-grade atrioventricular block and shows up on these FDG-PE scans. What does all that even mean for someone who's not a doctor?
You're right, that's quite a mouthful. Let's try to break it down a little bit. Cardiac sarcoidosis is another type of inflammatory heart disease, but instead of directly inflaming the heart muscle like classic myocarditis, It causes these clusters of inflammatory cells called granulomas to form in the heart muscle.
And those granulomas, those are the problem.
Exactly. They disrupt the heart's normal rhythm, which is where that atrioventricular block comes in. That's a fancy way of saying that the electrical signals that control your heartbeat are getting blocked.
Oh, wow.
And it can lead to all sorts of problems. Arrhythmias, heart failure, even sudden cardiac death.
So pretty serious stuff. How do they even diagnose something like that? Those FDG PET scans you mentioned.
Those are a type of imaging test that can spot the inflammation and granulomas in the heart. But before jumping to that, doctors would start with a thorough history, physical exam, and likely EKG and echocardiogram, just like with classic myocarditis.
And the treatment for cardiac sarcoidosis, is it similar to giant cell myocarditis?
You're on fire with connecting the dots today. Yes, it often involves immunosuppressive therapy, usually with corticosteroids, and sometimes additional medications like methotrexate or azathioprine are needed as well.
It's incredible how the body can turn on itself like that, causing these serious heart conditions.
It really is.
Yeah.
And it highlights just how complex the human body is and how much more there is to learn.
Speaking of learning, I wanted to circle back to something we touched on earlier about diagnosing myocarditis. You mentioned EKGs and echocardiograms, but the JAMA review pointed out that those tests aren't always enough for a clear diagnosis.
Yeah, they said sometimes further testing is needed, like something about a cardiac MRI and even a biopsy of the heart muscle, which honestly, that sounds kind of intense. It is, but it's sometimes the only way to be absolutely sure what's going on. Think of it this way. An EKG shows the heart's electrical activity, like a rhythm section, while an echocardiogram uses sound waves to create images of the heart's structure and how well it's pumping, like a visual checkup. But a cardiac MRI gives an even more detailed look at the heart, highlighting any inflammation or damage. But a biopsy, that's like looking at the heart's blueprint under a microscope.
So it's about getting the most accurate information possible to figure out the best course of treatment, which makes sense because, as we've been discussing, the treatment for myocarditis really varies.
Precisely. And that's why being your own health advocate is so crucial. If something doesn't feel right, or you're not getting the answers you need, don't be afraid to speak up. Ask for more tests. Get a second opinion.
Yeah, don't be afraid to be your own best advocate. I love that. So we've covered a lot about what causes myocarditis, the symptoms, how it's diagnosed, and the various treatment approaches. But what about prevention? Is there anything people can do to lower their risk in the first place? That is the million-dollar question, isn't it? So is there like a magic shield we can wear to avoid myocarditis completely?
Oh, I wish. If only it were that easy. Unfortunately, there's no foolproof way to prevent it entirely.
Okay.
But there are definitely things you can do to stack the deck in your favor.
Okay, so less of a magic shield, more like boosting our defenses. I'm all about that. What's the first line of defense?
The basics are surprisingly powerful. Remember all those wash your hands lectures from childhood?
Yeah.
They're still relevant. Good hygiene, like frequent hand washing, is huge for reducing your exposure to viruses, which we know are a major culprit in many myocarditis cases.
Right, because sometimes the best offense is a good defense, as they say. And I'm guessing like staying up to date on vaccinations kind of fits into that category too.
Absolutely. Vaccinations are like training your immune system to be a lean, mean, germ-fighting machine.
Right.
And when your immune system is strong, you're less likely to get those nasty infections that can sometimes lead to myocarditis.
Makes sense. And it's not just about avoiding germs, right? I bet good old-fashioned healthy living plays a part too.
You know it. Think of it like this. A healthy body is a resilient body. Eating a balanced diet, getting regular exercise, even just going for a walk, and finding healthy ways to manage stress all contribute to a stronger immune system, which, as we've established, is key.
So it's really a holistic approach. Taking care of your overall health is one of the best things you can do to protect your heart, myocarditis, or no myocarditis.
You got it. It's about giving your body the best chance to thrive.
This has been incredibly eye-opening. We've covered so much about acute myocarditis today, from what causes it to how it's diagnosed and treated. But there's one thing that keeps coming back to me, and it's something the research actually touched on. The incidence of myocarditis, like the number of cases, it seems to be increasing worldwide.
You're right. It is something researchers are trying to understand better. It could be a few things. Increased awareness and diagnosis mean more cases are being identified now than maybe in the past. But there's also this thought that environmental factors might be playing a role, which is,
Kind of wild to think about.
yeah, it's pretty wild to think about.
There's still so much we don't know.
Right.
And I guess that's the perfect example of why we need to support research, stay informed, and keep asking questions.
100%. The more we understand about what causes myocarditis and how it develops, the better equipped we are to prevent it, treat it, and potentially even cure it someday.
Well said. And on that note, I think it's time to wrap up this deep dive. But before we go, I want to leave our listeners with one final, slightly mind-bending thought.
Lay it on me.
Okay, so throughout this entire deep dive, we've talked about all these different triggers for myocarditis, right? Viruses, medications, even vaccines in rare cases. But what if some of us are more susceptible to those triggers because of our genes?
Now you're getting into some really cutting-edge stuff. The JMA review did mention some genetic links, especially in those with more severe cases of myocarditis. But you're right, it feels like we're only scratching the surface when it comes to understanding the role genetics might play.
Right, like imagine if we could identify specific genes that make someone more vulnerable to myocarditis. Could we tailor treatments to their genetic makeup or even develop preventative strategies based on their unique risk factors? It's like personalized medicine but for your heart. That's the dream. And it's why this type of research is so important. The more we learn about myocarditis, including those genetic links, the closer we get to that reality, to a world where we can potentially prevent this condition altogether.
It's amazing to think about all the possibilities. And on that hopeful note, I think we'll wrap up this deep dive. But remember, the learning doesn't stop here. We encourage you to keep researching, keep asking questions, and keep advocating for your health and the health of those you love.
Well said. Knowledge is power, especially when it comes to your heart.